2 years ago, I had LASIX when I retired from driving a truck. After the LASIX, everything was fine, and all of a sudden I noticed my vision was falling off. When I covered my left eye, I couldn't even see the chart with my right eye. So my physician says I better go see an eye doctor. I made an appointment with Dr. Richheimer, and he diagnosed me with a disease called Fuchs disease.
This is a disease of the cornea that's inherited, and it's one that causes progressive swelling in the cornea. The cornea essentially takes on water and gets puffy over time. In its early stages, it can be managed without surgery using medicines to help keep the cornea from getting too swollen. But as the condition progresses, a cornea transplant's necessary.
I didn't have a choice, really, because the description of the disease will eventually lead to extreme pain, and I would lose the vision completely.
10 years ago, with technology, a full thickness cornea transplant was really the only kind that could help him, and that takes typically a year, if not longer, to recover from. Now, with the help of a newer kind of cornea transplant surgery, Tom was able to recover vision much quicker than that. Essentially, this uses a very thin layer of a donor cornea transplant. And I don't remove Tom's entire cornea or the full thickness of it, but just a very thin layer of it, and essentially replace that without using any stitches.
What he did was he took the donor cornea, took off the dead filters, the dead cells, and transplanted the donor's cornea, which was wonderful. And I was able to start seeing right away. It's amazing.
Tom is doing well. His vision is very stable, and just very thankful he had such a wonderful result.
Guy's a miracle worker. Really a miracle worker. And I couldn't be any happier. Couldn't be any happier. He's a fine doctor.